The Alabama Senate unanimously passed Senate Bill 252. It's more commonly known as the Community Pharmacy Relief Act. It will bring more regulations for pharmacy benefit managers in the state. And our Gabe Glassman has more on how it could affect costs for consumers.
The Community Pharmacy Relief Act will bring more regulations for pharmacy benefit managers. These PBMs are a middleman between health insurance companies and pharmacists. The piece of legislation also introduces us to spread pricing. The Alabama Pharmacy Association, who has been heavily pushing for PBM regulations, says proposed changes would bring more balance between the two parties.
Anything overpaying comes down, anything underpaying comes up, and it levelizes everything out. So it does not add. A lot of times it's going to reduce what's being paid. It limits what a pharmacy can make on a prescription.
But opponents of the bill disagree on the impact.
So how can these bills currently in the Alabama Senate and House either positively or negatively affect consumer costs?
It's going to drive consumer costs up permanently. This is a permanent fee that will never go away, and it will only go up. It sets a floor for reimbursement for pharmacists. As costs go up on healthcare, which they do because of the drug manufacturers' cost, that employers are going to be concerned and may make changes in their plans that are going to affect families. Changes like higher copays or higher premiums. And in the worst case scenario, an employer may simply just do away with their health insurance plan.
The Alliance of Alabama Healthcare Consumers argue SB 252 would bring another charge for consumers.
This legislation is extremely expensive because primarily it includes a new $10.64 dispensing fee that would be added on to every prescription that is filled if someone is getting their insurance benefits through their employers.
But the APA says that's not fully the case.
We were very specific to put in this legislation that any change in the cost of dispensing could not be passed on to the patient or the consumer. This does not add to any prescription. This changes the way a prescription is reimbursed.
SB 252 is now halfway to the governor's desk, now pending approval from the House Insurance Committee. In Huntsville, Gabe Glassman, Fox 54 News.
We've previously reported on Alabama Senate Bills 93 and 99, which have similar goals to the Community Pharmacy Relief Act. Alabama Senate Bill 252 is essentially a combination of the two pieces of legislation.